On March the 5th, the President gathered people of all walks of life and all points of view at the White House and launched what I think is the most significant effort in many years to try to address the very severe problem of the healthcare system in our country. Let me start from the outset with a personal bias of mine. We have a healthcare financing and legal problem as opposed to a healthcare problem. We have a terrific healthcare system where doctors and nurses and therapists and researchers and institutions do a great job, and we are blessed to live in a country with the talents of those men and women. Because of the legal and economic structure that supports that system, we have a problem where far too few people get access to that system, where a lot of providers feel they're being driven out of the system because their very good judgments are being second-guessed by people who do not share their expertise, and where many of us feel that money is wasted in the system not to provide and promote good health and to deal with illness, but for other purposes. So I start from the premise that we want to preserve the very high quality and very great talents of so many people who've given so much of that system, but we want to extend its benefits to everyone. And we want to allocate its resources in a way that's smart and fair and rational. It was a remarkable experience on March 5th at the White House. We had people from very different points of view who agreed that the goals this time should be held in common. And one of the goals that was, I think, universally shared was that we spend too much in the healthcare system relative to our national income, that we spend far more per capita than really anyone else in the developed world on healthcare and do not get the result that we should get from it. So first and foremost in the healthcare debate that this subcommittee, this Congress, and this country is going to have over the next couple of weeks and months is the question of how to allocate costs in a more rational and sensible way in that system. Closely related to that question, obviously, is how to cover everyone. The two questions are clearly integrated, and one depends on the other in every respect. We are going to explore a number of different points of view this morning that deal with that question of cost and coverage in the healthcare system. We have assembled what I think is an outstanding panel of people with a broad array of experiences, rich diversity of opinions, and we want to encourage a dynamic interchange between the members of the committee and the members of the panel. So the way that we're going to proceed this morning is after the opening statements are done, we're going to hear from the witnesses. And I would just finish my opening statement by saying this. The core problem, as I see it, is that for Americans, for American families, out-of-pocket health care costs have gone up at 3 times the rate that their paycheck has. So insured people have taken a pay cut because of the explosion in out-of-pocket health care costs. The number of uninsured people has metastasized as a result of this cost explosion. So I think the two issues go hand in glove, that until we have a more rational allocation of cost in our system and get costs under control, we won't get everyone covered. And until we get everyone covered, we won't have a rational cost allocation and get the costs under control. I think they are very much integrated questions and suggest integrated answers.